Assalamualaikum. Today I would like to speak about leptospirosis. Leptospirosis is an infection that affects humans and animals. It is caused by bacteria called Leptospira. Leptospirosis is distributed worldwide but is most common in the tropics. Leptospira bacteria infect a wide variety of animals, birds, and reptiles. Humans are infected unintentionally. Organisms are usually spread through exposure of mucous membranes, which is eyes, nose or mouth, or scorching skin to the body fluids of acutely infected animals, or by contact with soil or fresh water contaminated with the urine of infected animals. Signs of leptospirosis infection can be divided into two phases. After the first phase, with fever, chills, headache, vomiting or diarrhea, the patient may recover temporarily but fall ill again. If the second phase occurs, it is worse. The person may have kidney or liver failure or meningitis. This phase is also called Wells disease. The disease is endemic in most tropical and subtropical regions, with the risk of being affected by flooding, adventure travel, lack of sanitation, and exploding rat reservoir populations. People at risk for leptospirosis are those in contact with animals, such as farm workers, veterinarians, pet shop owners, plumbers, butcher handlers, and others. The mode of infection is as follows. Direct exposure to water contaminated by the urine of infected animals, consuming food or drink contaminated by the urine of an infected animal. The first case of severe leptospirosis in humans was recognized in 1927 in Malaysia. Today, at least 33,000 cases with 450 deaths have been recorded since its inception as detectable disease in 2010. Next, the risk of leptospirosis can be reduced by avoiding swimming or wandering in water that may be contaminated with animal urine, or eliminating contact with potentially infected animals. Protective clothing or footwear should be worn by those exposed to contaminated water or soil because of their job or recreational activities. Cover skin wounds with a waterproof bandage. Then, seek medical attention immediately if experiencing symptoms of infection. Be mindful of our environment, especially when traveling. In countries with poor sanitation, people are more susceptible to leptospirosis. Do patients need to be quarantined? Patients do not need to be quarantined. However, the patient will be admitted to the hospital for further monitoring. As a conclusion, in humans, it can cause a variety of symptoms, some of which may be mistaken for other disease. However, some infected people may have no symptoms at all. So, everyone should always be careful with this disease as it can be fatal if not treated immediately.